Baltimore has a large number of individuals who have been disconnected from employment,
who have not had access to careers that will provide a sustainable wage, and healthcare does that. BACH was founded in 2005. It was formed to address that critical shortage of healthcare. We look for funding opportunities, and then we look to the community organizations and help them establish training programs. And then we connect them to the employers so that they have a clean pipeline to the hiring process. The critical mass at the table has to be the employer. And we actually insisted that it be employer-driven and that the providers of training listen to the employers. We developed the technical training program around the jobs that the hospitals identified that they were going to be hiring for in the next 12 months.
We've had over 250 promotions from that program, including over 100 nurses, and including in that is 2 nurse practitioners, and one of those nurse practitioners works with Genesis Physician Services.
It really works because we have built the relationships and the connections between the training providers and the employers.
Attending those meetings and working for a similar cause has increased the level of collaboration just among the hospitals in town.
BACH allows us to have that venue to share those best practices and be able to, do whatever we can for our frontline employees.
I think the National Fund is an amazing group in that it really has at its heart the workforce development process, but the critical part is the analysis of policy and the ability to look at best practices from a national point of view. So the National Fund really provides the opportunity to take the best.
Through the BACH program, there's people in the community there that are getting that education, and it's being paid for by a grant that the BACH program has gone out and secured. So I just think it provides opportunities in the community that some of those folks would otherwise not have.
Before healthcare, I was working for Immigration Customs Enforcement, and I got laid off. And then I decided I'm gonna go back into healthcare. Once I was hired, I wanted to develop more skills from not being in the healthcare for a while. Everything that has to do with the hospital, they went over. Medical terminology. So it was a busy 6 months.
Before I came and got in this program, I didn't really know what I wanted to do in life. But once I sat down and talked to Ms. Rush and everything, I was really focused on what I wanted to do. And I started liking biomed because the people in my department was helping me every single day ever since I came there, and I started liking it. I changed my degree to be biomed or physical therapist.
I think that it's important for organizations to invest in their employees because an engaged employee is a better employee.
And so it is our responsibility to go out and really open the doors, if you will, to those individuals, to show them that with a little bit of work and support through that process, they can enter the healthcare field and grow in it and be successful.